The gospel that I'm trying to preach is to my colleagues in medicine: understand what's happening, learn the facts, lift up your heads enough to see what's going on around you, understand the problem, and then begin to ask yourself, what can I do to help? When I started out in medicine in 1946, there was no such thing as a healthcare industry. The term healthcare industry had never been used. Nobody referred to it as an industry. And nobody thought that being a physician was a business. Now we are dealing with the inevitable consequences of a healthcare system which changed from a social service to a business. And just as you would predict, it ignores more or less those who can't afford to pay. It exploits the opportunities to make money at the expense of the obligation to use resources conservatively in the most effective, medically appropriate way. It invites all sorts of abuses, including fraud. And it's clear that it's not working, and it can't work, because there's a fundamental disconnect between medical care and almost all other economic activities in our society. A patient consulting a physician because they're sick or injured or worried or frightened that they may die or become seriously ill is not like an ordinary consumer in an ordinary market. And physicians should not be like vendors in an ordinary market. Their objective should not be simply to sell whatever the consumer will buy. Physicians are in the best position to decide how best to use the resources that we expend on health care. I've outlined what doctors might do if they wanted to. They could form multi-specialty group practices, not-for-profit group practices, that would be prepared to accept payment on a per capita, rather than on a piecework basis, on a per capita basis for comprehensive care. There's no question that that system would work. The only question is, how do we get it to occur politically in the current political climate? And that's a big problem. We're going to have to change the attitude of the public, and we're going to have to change the attitude of legislators. This issue of survival. We are simply not going to survive with the healthcare system we have now. It's going to implode. We must do something. And doctors could help get it started. At least that's my hope, and I think it's not unreasonable. One of the hopeful aspects of all of this is that pretty soon, half of all practicing physicians are going to be women. More and more multi-specialty groups are being formed, and women are becoming a very significant part of that movement. So I'm expecting that women may save the day.